Friends, today I am trying to discuss with one of the important sensory modality that provides us the sensation of position, the body position or the limb positions in space. This sensation has been hijacked by the other posterior column sensations. In the other way, it has got a less attention in terms of its receptors, the pathways, the destinations, as has been described for other posterior column sensations like touch, pressure, vibration, stereognosis, tactile localization, tactile discrimination. I scanned several textbooks I could not find, barring one or two, I could not find a very clear presentation of this sensation. Hence, I have made an effort to provide you the comprehensive aspect on proprioception. Think about doing any action or movement, just as in case of a bicycle riding. We do it effortlessly. We do it while talking to our friends, laughing at the jokes, seeing the scenery around us, or listening to the music, while performing, while moving, or while pedaling the bicycle. Such a effortless, such unconscious things are possible because of the proprioception. Proprioception, by definition, includes the sense of position and movement of our limbs. Senses of muscle force and effort, and sense of balance. So there are three components which have been provided here. In nutshell, it is the sensations of the body position or the limbs position, limbs or extremity position in space in reference to head or body. Regarding proprioception, 𝐻𝐵 proposed that it is the sensation begins from the cerebral cortex. Later on, Sir Charles Sherrington proposed that it is the sensation starting from the spine, the spinal cord or the body. Now, both of these parts are true. It is now placed as a sixth sense in the sensory modality. This is also known as a kinesthesia. Proprioception allows us to carry daily routine tasks successfully, unconsciously, effortlessly, with ease. In the absence of feedback from the proprioceptors, think how awkward our actions would be. So we will not be able to perform the actions as we are doing it. What are the types of proprioception? The proprioception involves both conscious and unconscious efforts. The conscious proprioception, just like if I ask you to touch your finger, you will touch. That means identifying a position of the joint or a part, or the part moved when asked. This is possible when we are conscious. That means the information is going up to the sensory cortex and there it is processed. There are two components in the proprioception. One, the stationary, and the dynamic, that is during motion. That means when I ask perform certain actions, where is that body part, I can still recall. Finger nose test, finger test with closed eye is one of the example of the conscious proprioception. Suppose if you have been given certain objects in your hand and asked you to tell the weight of the object, what do? You just toss it up on either side, on this hand and that hand, and finally you come up with a particular approximate weight. So that means the tossing provides that proprioceptive activity be proprioceptors activated, and then that provides the weight. We will also know the severity of the muscle action when in motion. Many other functions, but that requires the conscious state. That means the sensory cortex should be functional. The unconscious proprioception involves number of things happening while we are not conscious. Just for example, even when in motion we are thinking about and we are looking at certain things, suddenly somebody pushes, you try to bring back your position. In the unconscious proprioception, the position and movement of our body and its part, including dynamics. Dynamics includes the mass, the forces acting, the gravitational pull, and in relation to timing of the particular sequence of action. All that information is vested in the unconscious proprioception. This unconscious proprioception is processed at cerebellar structures. In comparison to the conscious proprioception, they are processed in the parietal cortex or sensory cortex, further with the somatosensory area, association area. The unconscious proprioception necessary for segmental, suprasegmental, vestibular and cerebellar reflexes or reflex alterations for posture and equilibrium. Thus, these unconscious sensations are integral of number of postural reflexes, including the writing reflexes. Similar to the conscious proprioception, there are static and dynamic components of the proprioception that I will be dealing in the subsequent slides. What are the receptors involved in proprioception? I have listed here in this table and for the conscious proprioception you can have those joint capsule refining end organs, joint capsule Pacinian corpuscles, stretch sensitive nerve endings in the joint capsule. Whereas in the unconscious proprioception, all the 6 items listed here will be participating in one or the other way. Just I am briefing the muscle spindle. The muscle spindle or the intrafusal fiber, this is located within the muscle parallel to the extrafusal fiber. These are encapsulated receptors. You have nuclear bag fibers, nuclear chain fibers, you have a static intrafusal fibers and dynamic intrafusal fibers. What exactly they do is they know the muscle length, they monitor the muscle length. That means a change in the length would be detected. Also, the rate of change, that is the speed of contraction, is also detected by these muscle spindle primary endings. The function is to maintain the length of the muscle and regulate the speed of contraction. These receptors are carried by group 1A fibers or A alpha fibers. These are fast conducting fibers with a velocity around 100 meters per second. And these are slowly adapting receptors. In the intrafusal fibers, we have on the polar end the secondary endings. These are annulospiral endings or flower spray endings. They also detect stretch and their function is to reduce the muscle stretch or modulate the muscle stretch. They are carried by the group 2 fibers with a conduction velocity somewhere around 50 to 60 meters per sec, carried also known as A beta fibers. These are also slowly adapting. We have another proprioceptor located in the tendon organs and also in the muscles. These are also known as Golgi tendon organs or Golgi organs. These are encapsulated receptors with a collagen covered, and they are also having a spray endings. That means they are present in different forms. They sense the excessive stretch of the muscle or excessive contraction of the muscle. Actually, they detect when the muscle contract very rigorously, very severely. So that means they try to regulate muscle tension, muscle activity, and twisting so as the muscle is not ruptured during severe contraction. These receptors are carried by group 1B or A alpha fibers. These are also fast conducting fibers with 100 meter per second conduction velocity. Just to brief you about the terminology 1A, 1B in sensory modality, the A and B suffix indicates the threshold of the fibers. Group 1A fibers have a low threshold. Group 1B fibers require a higher threshold for stimulation. Accordingly, they are called group 1A and 1B. These are also slowly adapting receptors. We have described the Ruffini end organs. They are present in the joint capsule all around. They are encapsulated. As has been described earlier, they carry touch, stretch, traction, and pressure. They detect the joint angle and torque. That means they regulate or modulate the joint angle and the torque, change in the angle. That means the twisting of the joint. They are carried by the group 2 fibers or A beta fibers with a conduction velocity around 50 to 60 meters per second. They are also slowly adapting receptors. We have another receptor in the joint capsule, that is the joint capsule Pacinian corpuscles. These are encapsulated, layered receptors. They detect the joint movement, they detect the direction and velocity, or they modulate the direction and velocity of the motion carried by group 2 fibers or A beta fibers. They are rapidly adapting receptors, as already been discussed. There are other group of nerve endings. These are free nerve endings located around the joint. These are free nerve endings. They detect touch, pressure, and they modulate excessive stretch and force on the joint, and they are carried by small diameter fibers, small diameter myelinated fibers, A delta fibers, or group 3 fibers. These are also slowly adapting. These are the receptors for the proprioception, both conscious or unconscious.